Okay, I think that's everybody now. So thank you all for coming. Um, Thanks for introducing yourselves. The first thing on the docket today is committee updates. So, Eric, correct me if I'm wrong, but do we only have one committee, or are there are there a few other committees that I'm not aware of?
Well,
All I'm involved in is outreach.
we only have the one committee for now, but we also have the larger working groups, the coastal groups, and we also have inland. So Alicia's with us. Karen's out through towards the middle of next month. So if you like, I can give a brief update for the Outreach and Education Committee.
Yeah, that sounds great. And then if other folks on the call know any details about like upcoming meetings for those other work groups, I think we should also just plug those. So yeah, go for it, Eric.
So we were busy this past year. It was our first year being engaged as a committee doing outreach and education. We teamed up with the Monitoring Council. Nick was great in facilitating our outreach efforts through the social media that he has for the council. So we leveraged that, participated in a whole bunch of just getting messages out, beautiful messages, great artwork, and sending those out to the Instagram, Facebook, all the various outlets that Nick has already lined up for everybody. We have our next meeting. I sent out an announcement to our committee members. It's January the 20th at 2 o'clock. It's about an hour and a half meeting. If you would like to join us, this is what we're going to be working on next year. Same number of events, plus we're going to be having an event early, and it's Engineers Week. And so we're going to be providing some information on how safe to swim embraces engineering, and it's kind of an educational outreach trying to facilitate education. Kids K through 12 that would like to talk to an engineer, engage with engineering, understand what it is and how engineering helps facilitate safe to swim. So that's what we're going to be working on for our first event, and then we're going to have quite a lot of time now to develop a really good educational outreach program to support Swimmable California Day, which is in the summer. So that's all I have to say right now, Luke. I really would like anybody that's interested in supporting our efforts to drive traffic to the Safe to Swim portal. The data that we have online, the maps that Michelle Tang has been helping us develop, and then also try to produce tools that teachers can utilize. Luke has some of the tools available on Heal the Bay's website. I have some stuff on mine, and we've created a link to all of those things on the Safe to Swim water quality portal. So be glad to respond to any questions that people have to join. You can send me a chat. You can also just email me directly. That's eburris@waterboards.ca.gov. Thanks, Luke.
Yeah, thanks, Eric. And that first outreach that we're going to be doing at the beginning of the year, that engineering day, that will be a cool opportunity to kind of brag about some BMPs, highlight, water quality improvement projects. So yeah, any folks out there who have some ideas or projects in mind that you would like to educate the public about, feel free to reach out to Eric and get involved in that committee. So let's see. The next thing on the docket is grant letters. Sorry, Eric, I'm going to ask you to speak again. You added this item to the agenda, and I wasn't totally clear on what it was. Could you elaborate on the grant letters item?
Yeah, one of the things that the network wants to do is try to help facilitate Safe to Swim. And one of those ways of helping is to provide letters of support for grants. So if an organization is going after a grant for putting in a BMP, going after funding for laboratory expansion, training, any effort like that, we'd be glad to help facilitate that, putting out a letter under the network itself, working with Nick and the Monitoring Council to get a letter out. This year, we received one request. It was from the City of Long Beach to help them with a project. So we put together a letter of support. It was signed by Nick and sent out. And although the city did not receive all the funding they were requesting, they did receive some money to move forward on some of the projects that they were working on. So just want to let people know that there's opportunities of interacting with the network and the council so that you can get letters demonstrating that your project is worthy of funding, and it's something that we would like to do for you. Also, regarding grants, the state library now is facilitating a email listserv announcing grants. So if there is a grant from a state agency, a California state agency, it will be announced through that web portal and their listserv. So today's email from them, something that may be of interest to you, is putting in floating restroom facilities. So if you have a lake, you're working with boating community, with the lake managers, there's opportunities through the California Boating and Waterways to get grant funding to support those types of projects.
Thanks, Eric. That's a really good update. Would you be able to find the link to that web portal, or is it a Lyris that you need to sign up?
I'll put that into the chat. I'll look it up and put it in the chat. Okay.
Okay. Yeah, that would be great. We would definitely be curious. And to circle back to the grant letters, yeah, now I understand what that item was, Eric. Yeah, we wrote that letter to the City of Long Beach, or on behalf of the City of Long Beach, and yeah, just speaking on behalf of Heal the Bay, like we do that from time to time on our own or on behalf of this work group. So yeah, if part of the grant requirement is getting, support from stakeholders, definitely consider the work group and reach out. And then another thing I wanted to mention that I forgot to, the other work groups, the Ocean Beach work group and the Inland Beach work group, are there any upcoming dates that we need to know about there for folks on the call who are involved in that stuff? Yeah, are there any like upcoming meetings or anything like that? Can anybody speak on that?
We have Catherine Walsh. Maybe she has some updates from Karen Black, and then Alicia Wenzel is also with us. So if you guys have any meetings, any activity, if you could share that with us, thank you.
Hi, so this is Kat Walsh. So we had to postpone our November beach water quality work group meeting, and we're going to try and reschedule it. We're still looking at dates. But once we pick a date, we'll announce it to the email subscription listserv.
Thank you, Kat. Looking forward to that meeting.
Me too.
And this is Alicia for the Inland Beaches group. I have gotten sidetracked the last year or so on my regional projects, but I do want to get back to some of the things we're working on for the Inland group. So nothing scheduled yet, but I will try to work on that because I know we still had a couple things pending, including trying to develop recommended sampling procedures for bacteria sampling, and also talking about voluntary guidance for posting beaches, which there seemed to be a lot of interest in.
Sounds awesome, Alicia. Thank you.
Yeah, those are some big topics that I'm excited about. And
I know, and it's just finding the time to really dig into them, which, but I know they're really important. So yeah, we'll try to get to work on that.
Yeah, and it's been a crazy year, so go easy on yourself. All right, the next item here, sorry Eric, I'm going to have to tag you in again. Update on COVID webinars is the next item on the agenda. Care to share?
That was something Karen Black was organizing. Did she share anything with you, Alicia? Or maybe Kat could chime in on that?
Yeah, I haven't heard anything. I know we put out that poll to solicit questions, and we got some really good feedback, and then we sent that over.
Could you share with the attendees what that was about?
Oh, you're gonna go back. So I think, if I remember correctly, that, there was the offer to kind of do a webinar that was California specific on kind of COVID monitoring and water quality impacts, and to make sure that they could address our questions. They kind of asked, what questions California
was that
had.
EPA or CDC? Yeah.
I believe it was the CDC, and I believe that we were discussing maybe having them record a presentation for us, answering some of the specific questions that we collected.
Yeah, that's the last I heard too.
So we're just waiting to hear back from CDC then. Okay. Thank you.
On another note along those lines, sorry for the background noise, the council is looking into, they're forming a subcommittee around the wastewater-based epidemiology and COVID-19, the early kind of warning system. We presented it on the last few council meetings, which are on the YouTube channel if you're curious. But they're looking at putting together a subcommittee to focus on a series of webinars with the idea less about information sharing, but more about how to bring the information together from all these different entities, whether that be the POTWs or the federal government and what the state's doing. And so they're supposed to report back on that on February 11th at the next council meeting. So they're looking at, and there's also a data-centric webinar that they'll leverage the Internet of Water that's focusing on the data management pieces associated with all the data being collected with this. So that could be something to leverage or to utilize.
So, Nick, just to clarify something, it sounds like they're exploring some early, warning system, early, sewage detection system for pathogens, or just COVID in particular?
This is particularly, it's for COVID right now. It would be applicable to other type of virus-related things that are using the RNA detection. That could apply to other things, but it got a lot of attention and has ramped up with some funds from CDC and leveraging some stuff with the public health to get the top 5 biggest POTWs to start sampling their influent and providing that data specifically because you could detect the virus before symptoms in the waste and potentially alert local hospitals and public health entities that there's a surge possibly coming based on the data we're seeing at the wastewater treatment plants. But it could be, the technology could be applied to other things in the future, but it's specific right now to the COVID, SARS, COVID virus.
Great. That's a really promising update there. any folks out there have any questions for Nick or anybody else on what we just discussed, or have anything else to bring up, for a minute? Anything you want to mention? Okay, I think we can move along. We might have some time a little later on for some more updates if something pops into mind. Next item is I wanted to start a discussion on how summer monitoring efforts went for everybody. So last time we met was in the spring, kind of before a lot of the COVID issues kind of ramped up. So I think it would be good for this discussion and just see how things went for everyone. So what did you folks experience this past summer? Like, how did the pandemic impact your sampling program or regime, if at all? Did you find yourself scaling back or ramping up, or what was it like? Anybody care to share?
Since we didn't have too many of the coastal meetings or the inland work group meeting, it'd be great to hear how people went about their monitoring season.
Hi, this is Lauren from Orange County. Can you hear me?
Yep.
Yes.
Okay. So we had a couple of the beaches that were closed due to COVID that we couldn't actually access because either there were barriers or police tape, things up like that. Otherwise, it was pretty much business as usual for us. We still did the majority of our sampling. Anything we could get to, we did, and we ran and we posted. We just added some additional language onto our website with some information about COVID as well, and to refer to each of the individual beaches' websites as well to make sure that they were open. So we still did everything.
That's great to hear.
Yeah, that is great to hear. Any TMDL folks want to weigh in? I know there were some struggles, and there were some applications for extensions. So yeah, just curious.
I have a question for Alicia.
Yeah, sorry, I was just about to chime in, but
with the COVID issues and then some of the encampment monitoring problems up there on the American, what kind of struggles did you guys have? Because I know you've been really busy this summer.
Yeah, so it took a lot more effort and coordination, but we were able to get pretty much all of our monitoring completed. We got a little bit later start to the year while we were waiting to hear from water board management on, whether we would be allowed to go out and sample and what kind of protocols they wanted us to follow. So we always work in pairs, and so that meant, separate vehicles and wearing masks all the time, which was a little fun to get used to. We had some more complications this summer with the smoke, which created a whole another health concern. So I think we did end up we did pretty well, but I think we had to cancel one or two sampling events or shorten them, just kind of hit our really high priority sites. So we were worried about having staff out there for prolonged periods. And I know Hope Taylor is also on the phone, so we've been coordinating with some of the local agencies to do the source tracking work on the Lower American. So it was interesting because they had a contract boat crew out doing sampling while my team hit the sites from upstream and downstream of there. But yeah, so I mean, we were able to get out there and make it work. But yeah, it took a lot of work. It took a lot of effort.
So yeah. Alicia, you were saying upstream and downstream sampling, that's of homeless encampments. Is that right?
So we're not actually trying to sample the homeless camps specifically. Usually that's difficult because they move around. That wasn't as much the case this year, but what we have is for the intensive sampling design for the source tracking, we have sampling sites on either side of the river, about every mile or half mile up the river, and trying to select those sites based on different types of inputs. Next year, we'll be going into a second phase of the study, which is the part of the river where there's really a lot of camps, so we'll have to tackle that even more. I think it's, just as far as I think sampling crew comfort levels and just kind of trying, how much do we want to, I don't know, kind of infringe on campers' personal space, trying to balance that with getting good data. I don't know, if anyone else has had to deal with that. For the most part, I think our interactions are fairly positive with the folks out there. A lot of them that we talk to, they're very aware of the monitoring, and we'll ask about what the results are. But, we also know that from other citizens that like to send us lots of pictures that there is buckets of poop being dumped into the river. So it's an interesting balance.
Yeah. So for Heal the Bay, that is definitely something that we've run into sampling the LA River because that's where a lot of folks without homes end up living. So we usually take an approach of just keeping their respecting their personal space and going around if we have to get to our monitoring sites. If we do cleanups, we make sure to leave a big buffer zone so we don't accidentally pick up any personal items and things like that. Another thing to just note here is there has been a big so in LA County there was a large spike in the homeless community here, but that was measured in January. So it's entirely possible that since then the population has grown even more. So just another thing to note. And kind of on that theme, I noticed throughout the summer that I would go to some places and restrooms wouldn't be open, which was a concern to me at some of these recreation sites, particularly freshwater recreation sites. Did folks run into any restroom issues this summer? Any restroom issues that led to water quality issues? Anecdotally, like I said, I saw in the Angeles National Forest here quite a lot of surface deposits as a result of the restrooms being closed. So, yeah, can anybody have anything to share along those lines, or wildfire too? Have any wildfire impacts like Alicia did? Anything like that? Here's one thing I was hoping people might have some numbers on. Was anybody keeping track of crowd size this summer? At beaches or inland recreation sites at all? Can anybody share about that?
Yeah, we don't do actual counts, but I would say during the summer there were a lot of people out on the rivers. I don't know if everyone else saw that.
So,
Yeah, we noticed many more people out, and the beach looked like Labor Day weekend, like every day over the summer in Southern California. Anybody else have a similar experience? All right, well, I'll keep moving things along, and like I said, if folks have things they would like to share, feel free to mention those. There'll be time. So moving along to less of a recreational emphasis, I wanted to discuss the CDC monitoring guidelines. So Alicia alluded to some of this earlier. I was hoping we could all share the COVID precautions we've all been taking for our monitoring staff. I think it would be really good to just share ideas, maybe discuss what you think of the CDC guidelines, and because there hasn't been a standardized procedure other than the CDC guidelines. So Alicia mentioned separate vehicles for monitoring staff. That's also what we did. We of course required mask wearing, even though it was outside. Anybody have anything to share, like special COVID procedures you put into place?
Hi, this is Lauren again from Orange County. So it's pretty similar. I try to separate the staff as much as possible if there's more than one going. Definitely mask wearing. I have gloves for them if they so want to use them. Hand sanitizer and wipes for the vehicle. So every time they would get in the car, they would sanitize the steering wheel, hands, everything like that. And then just being aware, spatially aware, and trying to maintain a distance from people while they were out taking the sample. We also had different protocol put in place if we suspected there was a sewage spill. So with that, we actually have face shields and more equipment if we were to need that to go investigate. But knock on wood, at least we've been pretty good with sewage spills where the ocean is concerned this year. So those are some of the things I think are pretty typical, but for my sampler at least.
Thanks, Lauren. And also I'm hoping nobody had any monitoring related COVID cases. But yeah, like I said, please share if there are any lessons learned, and precautions you were using.
Yeah, I can add a little bit more. I know because with the state we use shared vehicles, we do have a protocol to use bleach wipes after every use. Trying to think of anything else that we're doing. For safety concerns, we do like to send 2 people out, especially to some of the locations in our urban areas. So it's workable, I think, but it takes more vehicles, more resources.
Were there any changes in handing off a sample to a laboratory? Did they take any increased safety precautions, or was it just the same as usual?
For us, it was, it's pretty much the same as usual. The lab we were working with, they only allowed 1 customer in at a time, which is fine, and, definitely wearing masks. And I was already in gloves, so yeah, everybody seemed pretty conscientious.
This is Joe Guzman from Public Health Lab in Orange County. So we did implement some safety precautions when the samplers drop off. We do actually now that we do have plexiglass barriers that separate the sampler from the lab staff collecting the sample. We are limiting the number of people that come into the lab so that we're maintaining the distancing. The other thing we implemented just recently is temperature checking. So if the sampler will be in the lab for more than 15 minutes, then they have to be subjected to a temperature check to make sure. But we have a lot of signs at the door as well that say if you have any symptoms at all, you can't come in. If you can't come into the lab without a mask. So there's a lot of signage now outside the lab before the samplers come in, so that they're just aware of all the precautions that we're taking as a result of the COVID.
Thanks, Joe. And curious, inside of the lab, how many folks would you have working at a time in there? And did they have set workstations with plexiglass, or how did it work inside the lab?
Yeah, so we're fortunate enough that we have enough space so that the workstations where they're actually processing the samples, there is more than 6 feet of space in between, so we didn't have to put up barriers, but at their workstation, so at their desk where they're doing paperwork or at the computer, we could not separate those, move those because they're set workstations. So we did put barriers in between each of those workstations so that they felt a little bit more protected. And again, all staff are required to wear masks inside the lab. We don't take breaks at the same time. We've limited the number of seats at the table so that we're keeping the 6 feet and distancing throughout the workday as well. Staff are required to take their temperature before they come into work. If they have any symptoms at all, they are to call in so they don't expose coworkers. And then we do temperature checks throughout the day as well. So before you come into work, and then usually when you're coming back from lunch, you just take a random temperature check to make sure, just to make sure everything's okay.
Great. I think that's a great idea. We've been doing one temperature check as you come into work, but I think the continuous ones throughout the day, a little safer, probably a little better.
Yeah. And we do have a sign-in area, so anyone that comes into the lab for an extended period of time has to do a sign-in sheet, and at that area, that's another interface between clients that come in the door and staff. So they're at the sign-in area. There also is a plexiglass barrier.
No, they're not moving it back there.
Yeah, and the county has recently actually developed a program plan, so they've formalized and documented all the steps that the county is taking to make sure the workers are protected, as well as anyone that comes in to any county facilities. So at first everything was just training and doing, but now they've actually formalized it, and there's actual documents coming out that spell everything out of what staff and what the public's responsibilities are when they come into a county facility.
Okay, great. Thank you for that. Thanks for sharing. I'll share a little bit about Heal the Bay monitoring. So we some of the expert precautions we took were we did no water contact. So we got some extra long gloves. We got the elbow length exam gloves, so that when we dip our arms in the water did not contact our skin. We of course had boots, and we used a face shield when we sampled storm drains, which, looking back on it, should have been our practice since the beginning, since there's many more nasty things in the water besides COVID. So it's good we're doing that now. And yeah, we could only have one person in our lab, unfortunately. So all the sample running had to fall on one person there. And then one thing we had everybody do who was out in the field, we had them in their separate vehicle bring a change of clothes just in case they did slip into the water. They could get the potentially contaminated clothes off them. So that's another step we took, and luckily nobody had to do that. So yeah, anybody want to share anything else?
Luke, if you used any sampling devices, how are you treating those in the field?
Yeah, great question. So, like I said, we had separate vehicles. We had everybody doing separate tasks as well. Therefore, all the equipment was separate. So whoever was going out into the river and collecting a sample, that was all they were doing that day. Whoever was data recording, that's all they were doing that day. So no equipment was swapped. The equipment was sanitized between sampling locations regardless, just to make sure there wasn't any contamination from site to site. And then once everything was wrapped up at the end of the day, the equipment got sanitized once more. So that's how we treated all that stuff. We also had we got like those airport bins, that you put all your stuff in at the airport. We got some of those, and all equipment was kept in those in the vehicles from site to site, just to limit like vehicle contamination. So we probably went over the top, but it's worth it. So that's what we did. And Eric, yeah, well, while I've got you, I was curious what your summer looked like in terms of like monitoring with community members.
Most of the community groups and citizen science folks weren't able to go out there monitoring, so it was basically a shutdown for them. We did have some counties open up where folks could go out there and sample, and some of the organizations, it was just staff. They just wanted to keep their volunteers safe, and it was staff going out there and doing the monitoring, pretty much following the same protocols that everybody's talked about. And then slowly, I've heard rumors of folks that were sheltering together as that's a sampling team. They were able to go out there and do some monitoring. But it's been a very slow year for groups going out and collecting data. Fortunately, some of our citizen groups have been out for like 20 years. And so missing a year, it's not going to affect their trends. But we didn't have the specific data that we could share with folks, which is unfortunate. But it's been a busy year otherwise. A lot of our groups are busy just doing planning, putting together projects, applying for grants. I did a virtual training just last week. So it's been an extremely busy time, even though folks can't go out there and grab a sample.
Thanks, Eric.
Hey, Luke, can I ask what you use to sanitize equipment between sites?
Yeah, so we bought some ethanol, and we made 70% ethanol in spray bottles. Mm-hmm. That's just kind of like a standard lab, disinfectant. You could also do 10% bleach, but I didn't want to bring bleach out into the field. Something just made me uneasy about spraying bleach out in the environment. So we stuck with the 70% ethanol, and sprayed down boots, wiped down the turbidity meter, and basically anything, the face shield. So.
No, that's a good idea. We do that at the end of the day, but I'm also thinking maybe we need to add some of this information into the sampling protocol, even if not just for this year, like you were mentioning, just for folks out sampling stormwater or other.
Yeah, yeah, that's what we've come to realize. Like, just thinking about it, we probably should have been taking some of these precautions earlier. If we're dealing with raw sewage.
Well, I know one of the comments I got early on, because we put in, to change your gloves between every site, and someone was saying, like, really? Is that really necessary? It's like, oh.
Yeah, that too. Yeah, we were doing that, and let's see, we would have, a plastic garbage bag, and that would, remain with one person throughout the day, and yeah. We would even spray the gloves before taking them off, just to be extra safe.
Alcohol is good for everything.
Yeah, right. I had another thing to share, or a few other things, just share about some other monitoring programs in the area. So LA Sanitation had some difficulty reaching some sites this summer due to overcrowding. So due to like safety concerns for their water quality monitors. So to access some of these sites, you have to be on a pretty narrow path and, hike through a canyon. And as I mentioned earlier, again, this is only anecdotally, I do not have numbers on this, but it seemed like trails and parks and beaches were extra crowded this summer. So yeah, there were some areas where it just wasn't safe to walk down that narrow, canyon path to get to the sampling location. So those had to be cut out of the monitoring, and there were just some locations that literally burned. So that was another factor that had to be dealt with, just inaccessible due to wildfires. So yeah, a pretty crazy summer for everybody. Anyone else have things to share with regard to safety and monitoring?
Hi, and this is Lauren again. So the other safety thing we had was also dealing with the wildfires. We had 2 that came to Orange County. So it was monitoring the air quality to make sure that the staff were safe when they were out. Being by the ocean, it was a little better. And then the other thing was at some point staff were evacuated, including myself. And at that point, it's okay, do you get a recheck or do you go evacuated? Okay, well, evacuation is a little more important. So scheduling and juggling of staff to make sure that everyone was doing the safest thing they could be at that time. So those were, on top of COVID, very, very exciting.
Wow, that must have been very difficult being evacuated like that. Can't imagine.
Yeah, it was the one that we've had 2 in Irvine. So the first one that came to Irvine got evacuated. Still worked from the evacuation point, because most of my staff and myself are working from home at this point, or remotely anyway. And I believe my sampler still went and got samples that day as well. But yes, just monitoring the air quality is a big deal when the fires are around here.
Thank you for sharing. And another thing to note, just looking forward with the vaccine finally being rolled out, yeah, there'll be a whole other set of things to consider there where, in terms of like vaccination rates and returning to offices and things like that. So Healed Bay hasn't thought of that yet, but that's kind of what we're looking forward to in the new year and coming up with our internal safety policies around that. So.
Luke,
Yeah.
Alicia, does that sound like we should put together a guidance document or some type of resource and make it available on the network's webpage?
Yeah, I think that would be good. And we could maybe touch on some of the vaccine stuff as well. I would need to research it, but yeah, we already have internal like safety documents and stuff, so that would be pretty easy to put together and send around.
Yeah, I think it was our HAB program, or someone did put together a document for the water boards that we were kind of using.
Yeah, that would be great to incorporate as well.
Yeah, we could share notes and see if anybody else has documents that we should look at too.
Okay, great idea, Eric. So if
who can we send those to?
you can send them to me, I'll aggregate all of that. Yeah, you'll get my email address in my presentation, or just reach out to Eric if you need, or I'll drop it in the chat. What am I doing? 1 second here. So yeah, if anyone has any safety protocols they'd like to send along, there is my email address in the chat. So we're a little bit ahead of our agenda here, not too much. So I was thinking, so we have a choice here. I had a presentation today. It was only going to be about 15 minutes. And Margarita, our other speaker, is not in the meeting yet. Margarita is a busy person, so I told her she'll be on at 11:15. So we can either take a break until 11:15, or if we want to jump ahead, I could give my presentation right now, and then Margarita will join us once that is over. Anyone prefer one or the other?
Luke, this is Eric. If Michelle Tang is still with us, looks like she is. She's been doing a lot of work and maybe has some questions for the work group regarding a map and some formulas that she's been working on. So Michelle, are you there? Would you like to?
Hey Eric, hey everyone. Yeah.
Thank you.
This is Michelle. I could give maybe a quick update on the work that I've been doing with the kind of the Safe to Swim map. I had actually, over the past couple of months, a couple of issues were brought to my attention. One was that I think with the map, there's an error with some beach watch results not getting into CEDN, which therefore doesn't get into the map. So I've been actually working on that. And I think we've identified the issue. There's a kind of a flagging issue that happened kind of on the CEDN side of things. And we're still kind of working on identifying the exact results that didn't make it in. But hopefully, I think pretty soon we'll have a fix. And so a lot of those kind of beach watch results, which aren't there currently, should show up on the map once we've kind of published the fix. So I do want to thank, I think a couple of people reached out to us about this and brought it to our attention. And I just want to thank those people for contacting us about it, because otherwise I don't think we would have noticed it. It wasn't really, just based on what I'm seeing so far, it's not really a very straightforward fix. It's not like we can just mark all of the results from this project as not having been in CEDAN. It's actually kind of a mix of a lot of different things. So quite a it's been a journey to kind of identify those missing records, but I think we're kind of getting really close to a good solution. Another, kind of on that same line, another issue was brought to my attention not too long ago about how there is I think an issue with how the map is currently dealing with handling like non-detect results. So typically, we would replace those values with 1/2 the MDL. And I think currently for some records, that calculation is not being done. And so that is also currently on my to-do list in terms of looking into it and seeing what's the issue there. But that is a pretty high priority fix. And so I'm hoping to get that done once I've finished the Beach Watch records fix. And then I think there are also a couple of other enhancements that I have just kind of on my to-do list, which I hope to get to kind of starting in the new year. And that deals more with kind of the geomean calculations. We had a bit of an internal discussion here at the water boards about, currently the map is calculating geomeans for any set of records that have more than one record. So even, for example, like looking at kind of the 8-week geomean, if it has more than one record, we would still calculate the geomean. And I know that's a bit of a deviation from the statewide objective, which requires 5 results for the calculation of the geomean. But that was requested. That was requested back when I kind of first developed the map. And so we had a bit of a internal discussion about whether we should show, just the five minimum sample calculation, or if we should open it up and include anything even below that 5 minimum. And I think we've come to a solution where we're going to offer the option to show both. So kind of add like a little toggle to the map where you can actually toggle between the 5 sample minimum calculation and then the more kind of conservative below anything above 1 sample. So that'll be hope to add kind of in the new year. And then once it's in place, we could also kind of circle back to the Safe to Swim network meeting and just demo it really quickly and get any feedback or comments that anyone might have. But that's kind of what's been going on with the whole Safe to Swim map. I don't know if that's what you had in mind, Eric, but just currently a lot of things happening right now, and hopefully a lot of fixes and improvements coming very soon.
No, that's fantastic. Thank you so much for all that work. Folks are out there doing their monitoring and producing data, and we're trying to drive traffic so people can make wise decisions, and that traffic's going to the tools on the Safe to Swim My Water Quality webpage, and you're the one making that map. So I really wanted to let people know that you're very busy supporting us, and most folks probably don't know who you are. And those are some big issues that you're dealing with now. So thank you for all the time you're putting into that. And if anybody wants to send kudos your way, now they know who you are and who's behind making that awesome map that we have. Or maps. We got several maps online now.
Yeah, thank you, Michelle.
Yeah.
Awesome.
Thank you. And I do really appreciate everyone. Thanks for the kudos, and also thanks everyone for reaching whenever you come across a bug or an issue. I am very happy to fix it and fit it into my schedule. So thanks again.
We're just going to jump right into the first presentation. So everyone, I would like to introduce you to Margarita Diaz, the Executive Director of Proyecto Fronterizo de Educación Ambiental in Tijuana. They are a nonprofit focused on spreading awareness about environmental health issues. I invited Margarita to speak because for folks in the U.S., we usually hear one side of the story regarding the Tijuana River. The reality is that the river and watershed do not care about borders. So I asked Margarita to come and fill us in on environmental and water quality issues down in Tijuana. So take it away.
No, thank you very much. Thank you, Luke, for the opportunity to talk to you guys and to talk, like Luke just said, to tell you what's happening in this side of the border and what are we doing as an organization here. So I will start talking about a little bit of the NGO that I'm the director of the NGO. And we are a nonprofit organization founded in 1991. So last week we turned 29. And we are dedicated to influence environmental policy and involving the community in actions that raise awareness and protect the integrity of coastal riverine ecosystems within the Tijuana watershed. So we have many years working in this area, in this region. And our Tijuana Waterkeeper program is one of our we have 3 programs in the organization, and this is one of them. And we started in 2000 when we got our license from Waterkeeper Alliance. And a little bit of Waterkeeper Alliance is an organization with the mission of having drinkable, fishable, and swimmable waters worldwide. Right now we are 350 waterkeepers from 45 countries. So it has grown very quickly, and we are all aligned. And our main activity the first one is to monitor water. Here in the region, in Baja California, we are pioneers because we are the first community lab that is taking this information and having this data in Baja California. In the whole peninsula, we are 4 waterkeepers that we are monitoring, but we are the only one in Baja California Norte, and we are the only ones that are monitoring weekly. The other, our friends are monitoring monthly. I want to share a little bit of our area. This is you can see the border right there, and this is one of the stretch. This is a point where we monitor. Here's a lighthouse, so we call this the lighthouse point. We monitor it right here, and in the U.S. they monitor just across the border. This is another site. Here's a park, and we have a problem here in this area, so we monitor it in this. We call it Parque Mexico. This is Playa de Tijuana. It's where the offices is where I live. Very happy. This is another area. This is a creek, so we have an outfall here, so we're monitoring here. This is the first 3 ones. You can see in the back is San Diego. This is the estuary. So this is the region. This is our beautiful coastline. So right now we have been monitoring in 5 sites. This one is sometimes we monitor, but mainly El Faro, the one that I show you, Parque Mexico, Cañadas Tecas, the 3 pictures that I show you. Then El Vigía, that is in the south part. So we have from El Faro to El Vigía, we have an area of sandy beach. Then from here to this one that is San Antonio Norte, it's like a creek, so you cannot go back into the water. There's no sandy area. And then we have another stretch from San Antonio down to Playa Blanca. So we have 5 kilometers here and 5 kilometers south. This red dot discharge of our bigger treatment plant in Tijuana, the whole city discharged right here. And also the river, the water that flows through the river, and you have read in the news that Mexico fixed it, and the U.S. says it's not right, the fix they made. But what they did is we have all the water that comes from Tecate, all from the up mountains, and then go down, but it crossed the whole city. So we have a lot of intrusion. We have a lot of sewage going to the river. So what they're doing is they're capturing here just before crossing the border, the water, so we don't have impacts in the estuary. But the problem is they're pumping the water to this point and charging to the ocean. So the problem stays in Mexico. It's not solved. They just move a little bit. How we do this monitoring? We go out and take our samples. We don't do it with volunteers. We do it with internships from the university here in Baja California, and I have a responsible person, a chemical engineer, that she's in charge of the lab. So we go to the ocean, we take the sample, we go to the same process, index process with enterococcus, and we do it by the book, as is supposed with our protocols. And this is a little bit of how many samples we have done. So we started the program started in 2010, but it took us many years to get the funding and get the space and all the things that we had to move. It was hard. Also, the government here in Mexico was not very happy that we were going to install a lab. So they were telling us that we couldn't, that it was not possible, that the only people that can monitor it was the government. But looking through the laws and everything, we find out that it was not true. We could do it if it was with our means, with our money and our time. So after going through all those things with the government, also it was very, very hard to get the money because we couldn't get it from Mexico. We got it from the U.S. So we finally got the money. We established the lab. We started in 2014. This was half of the year. San Diego Coastkeeper was one of the main mentors that was helping us to set up and have the program running. So since 2014 till 2019, we have 1,019 samples. This is some graphics, and I started in 15 because 14 we were getting the hang of the lab. And you can see each line is each site. This red line shows the limit that we are supposed to have in Mexico. There is more probable number of enterococcus. In the United States, it's 100, and above 106 or something like that, the beach has to be closed, so it's marked as red. And in Mexico, it's 200, so we have a little gap here. And then you can see some of this data that is from the south of the outfall of the treatment plant. We have these high levels, and it's not like 200 and then you have 300. Here goes above 1,000. So we did some geometric so it will show inside the table. So what we encountered here is in 2015, like in October, November, we had this big peak, a lot of sewage. It was very, very bad, this area of the beach. And then the next year, as you can see, it was not working right because the whole 2016, it was very, very bad situation. We had 3,000, 4,000, 5,000. It was high, and also the other beaches were pretty under the 200. Then in 2017, it was still the treatment plant. When we were talking to the government, we were saying the treatment plant is not working, it's broken. We can see it. We 1 kilometer south of the outfall, we were monitoring in the outfall. So it was, and the government was saying that everything was okay, and we were very pushing and asking the government to close the beach, that portion of the beach, that it was the south part, the 5 kilometers of beach, because it's one area that many surfers like to go there. Also in 2017, it was this big spill and all these problems in Mexico because we have a very big heavy rain. So this was a very bad year, 17. And at the end of the year, we finally, well, at the beginning of 18, we finally got the government to say that the beach, that area was closed. But they just said it in a meeting. They didn't put signs. They didn't advise the people. So we were very upset with that. In 18, also, as you can see, the numbers were high and off the chart. 19, it was the same, and started to have other areas that were also out of range. So it was getting north also. But mainly, as you can see, our problem in these graphics is that we have the problem in Mexico. We didn't have many, some of these are El Faro and Parque Mexico, and they were under the limits. So our problem, and we're talking to the government, is they were very, very looking to the U.S. side and saying, like, we have a problem with the water from Mexico crossing to the U.S., but here our information, and you can see here El Faro, the lighthouse, just at the border, all these sides. So if we go from El Faro to San Antonio, is going south. This is the farthest point. The treatment plant will be here in the middle, and then you have this one. So you can see here that the impact of the treatment plant is in Mexico. It's really bad, but it's in Mexico, not it's in the U.S. as it's seen in the newspapers. And what we have been doing is we have been advising. We have, as waterkeeper, we can use the Swim Guide, this app that is very useful, and we have been publishing the information because the government monitors every month or every 3 months, and they publish the information like 3 months later. So for the people that is going to use the beach, it's not very useful to have this information like 3 months after you took the sample. So what we do is we go on Thursday, we monitor, on Friday we get the results, and we publish the information. So the public is going to the beach on the weekend. They will have a little bit of certainty of what's the quality of the water. So we have been doing that thing weekly. And this is the amount of people that has downloaded the app and is using it. So as you can see, people are very interested, because also the government one meeting told me, like, no one is interested in that data. So I said, yes, there are a lot of people using the beach, and there are people, a lot of people who want to know if they can go into the ocean. So this is our numbers, and they stopped, as you can imagine, in 2019, because 2020 has been very, very difficult. We stopped our monitoring, and we have been encountering all these things, that the beach was closed, all this quarantine, and the problems that everybody knows. So we didn't monitor until the beginning of November, that the conditions were like a little better, and we decided to go out and see how things were out there. In the meantime that we were going to go out in the summer, the state governor published this sanitary alert. It was July 27. It was published like officially in our, this is an official publication, and it was declared again that is an alert. The same stretch of beach that you can see that from 2015 we were saying, like, we have a problem here, we have a problem here. Finally they say that it's closed. It's an emergency and it's closed. But again, they published it here, they said it, but it was not in media, there are not signs on the beach, so nobody knows that we are in an alert, and it's a declaration from the government. So we have been going out to media to tell people, like, don't go there, something is really bad. But from it, as you can see, in July, we were not monitoring. So we said, okay, well, now it's closed, it's better, and the other stretch of the beach was closed because of the quarantine. So we said, okay, well, no one is going into the water. We are not monitoring, but no one is supposed to go into the water either way. But on November, we went out, and it was I think from all these years, the worst scenario we have seen. All the beaches from El Faro to Playa Blanca, San Antonio, and we have scores of 20, like the whole trail was light up. So we couldn't count it because it was the whole thing. We have to do more dilutions. And it was very, very frightening because it was like the next week it was the same. We have very, very high numbers, and not only, and we have high numbers on the beach, like from El Faro to El Vigía, that is a very, the more public beach or the more used beach that we have. So generally these ones, as you saw in the graphic, they were clean, but now this is the worst data we have encountered. Then the third week we went back, all the beaches were very, very high. We have numbers that we didn't have before. And it was very impressive because we were like, people in media and social media saying like, yes, with this quarantine, everybody's at home and the nature and all the animals are swimming and jumping of joy because we are not there, but they're not because it's looking bad. So the fourth week, it's still high. We have these high numbers. And then we had to stop because we here in Tijuana, we came again to red light for the quarantine, so we have to go back. We stopped monitoring because we don't want to expose anyone. But in this time that we were doing this month in November, we talked to media and we asked them to go with us to do the monitoring. So we have a lot of media coverage about these results and telling the people like, please don't go into the water. We have a lot of videos and things. In this one in particularly, I'm talking and I'm saying like to the government that they have to focus in Mexico and stuff. Like it's important, this binational issue to be encountered. We have to work hand on hand with the U.S., but they have to be their attention in Mexico because they are Mexican government. They have to take care of Mexicans. And we have this binational also media coverage. So it was very important. We have a lot of views. One of the reporters from Badabun is a very popular YouTube channel, so they interview us, and so we have a lot of views from that. So this is we are saying like, stop, please don't go to the beach right now because things are not good. And we have been asking also for the government to redo the meetings. We have a program in Mexico. It was set up in 2003. It's called Playas Limpias, Comité de Playas Limpias, so Committee of Beach Waters. And we're sitting there, government, society, private sector. And just like in last month also was the first meeting of the year. And we have been pushing and telling them like, we have to talk about this, we have to do something, and it has to be signed out at the beach that the quality of the water is not healthy, and it's a public health risk that we are encountering here in Tijuana. So we are trying to do our best to keep up the work and to try to advise as many people as we can that right now is not a good time to go to our beaches because things are not working. We have a very big infrastructure problems here in Tijuana that are causing this. It's not just a treatment plant. It's a lot of developments that are on the coast that they don't have treatment plants. They just pour in the sewage to the ocean. So we have a lot of problems here in Mexico. And the thing that you read in the news, that is the water that is crossing through the river, I always tell them that it's a watershed, it's a coastal watershed, and it will drain to the ocean and it will drain through the estuary. So if it rains, it will cross. We cannot stop a river, but we can improve the quality of the water that is running in the river, and that's the job of the Mexican government, and we have to work very, very hard in that part. But I think it's not, because sometimes the government also says like, yes, we're going to stop the water from crossing. And I said, we're going to stop the water from crossing. We have to stop crossing polluted water. So that's different. So this is a little bit of what we're doing and what's happening here. And we are trying to work. That's why we Hilda Bay, we have been talking and trying to figure out how we can share information and how we can use more their app also and have this information to get to as many people as we can and in the right time and in the right way. Thank you.
Thanks for that, Margarita. So it's let's open it up for questions. Anyone have any questions for Margarita?
This is Nick. I just want to say.
Oh, go for it, Nick. Sorry.
I was just going to say this is great work, Margarita, and much needed. I was wondering if you did it beyond working with the keepers and NGOs. Have you worked at all with San Diego State University? I kind of put message in the chat about it, but when I went to school there and I was in the Center for Latin American Studies program, and there was a dual effort with the public health program at the university, and they would do some cross-border work where they focused primarily on the agriculture being done down in Baja California Sur, but I think that this would be another thing that they'd be really keen on partnering with, and I have some really good contacts there.
Yeah, it will be awesome. We have been also we're also been working with the county, San Diego County and the city of San Diego, that they do some monitoring here, and they have been sharing the information to us, and we have been sharing information. But yes, all the help, we have to do a lot of research because the decisions are being taken without much research. So we have to do more research, and the university will be perfect. Yeah.
Yeah, I think that'd be great because you could leverage not only the students, which is basically free labor, but also their grant funding and the expertise of the professors that oversee the program. And I have a personal relationship with the director of the Latin American Studies program, and I know she'd be really interested in talking with you about this. So if you, maybe if I can get your information, or maybe I can get it from Luke or whoever, I can definitely make that connection. Because it sounds like awesome work, and definitely needed, and I just want to applaud you for everything you're doing down there. It's great.
Thank you.
Yeah, Margarita, you can send your email in the chat, or I'm happy to provide Nick with it. But I had a question. I was wondering, does Baja California, does the government there sample at all? And how does your data differ from their data, if they do?
I just posted my email. The problem is that we don't have access to their data. Like, they posted in their official pages, and we can see only in vacation, like in spring break and summer, and that's it. And we encountered the last monitor we did, the team that was there on the beach doing their work, they crossed with the health authority, that they were monitoring also the same day, the same time. They went to them and they asked them like, oh, that's how lucky we are. We just find each other. And we want to see if we can share information because we are monitoring the same day, the same time. So we perfect to do cross information to see our data and see how our results are doing. They didn't want it. They were not very friendly, and we haven't got that information. So it's very difficult because we don't really know when they are monitoring. Even the lifeguards, when one meeting, one of the captain of the lifeguards, he was saying in a meeting, like, I don't know when the health authority comes to monitor because I don't see them. I see Tijuana water keepers coming, and I see the water authority coming, but I never see the health authority. So it's very, very difficult to get the information, even if we are like really, really looking for it. So you can imagine for the general public is non-existent. And so it's a very big problem. And also when I was saying like in 2018 that we finally got the authorities to close that beach through this committee, the health authority, the state health authority told us that since the beach was closed, officially closed, and the problem was still there, they stopped monitoring. So they don't have data. So the only data that we have is our data and the data from the water authority. So it's important. So it has a value, what we're doing.
Thank you. Yeah, any other questions? Okay, well, I take that as a no. So Margarita has provided her email there. Is that a good email address to send any, questions anybody has?
Yes.
Okay, great. So yeah, reach out to Margarita if something pops into mind later. And
thank you.
Yeah, thanks for joining us, Margarita.
Thank you very much for the opportunity.
So I'm going to give everybody a quick presentation on some of the work we're doing, looking at the effects of wildfire on recreational water quality. So this is kind of a timely topic coming off of a record-setting wildfire season in California with some of the bigger wildfires happening in coastal watersheds like up around Santa Cruz. So this is actually a project that's been ongoing for a few years now, and what I just want to do is kind of introduce the topic to everybody and just let you know what we're what we're doing and give you an update. So it's just going to be a quick little thing. I'll go over some preliminary data that we have. We started looking into the effects of the Woolsey Fire on water quality back in 2018. So the Woolsey Fire, a little background, it started in November 2018 and burned through December and into January 2019, lasting 56 days, close to 100,000 acres burned, and over 1,600 structures were destroyed. Here's a map of the burn area in purple. You can ignore these yellow dots right now, and for folks not familiar with this stretch of coastline, you're looking at Malibu. So this is Malibu here. This little point here is Point Doom. Oxnard is off to the left. Santa Monica and Los Angeles are off to the right. So this is the burn area. This is that 100,000 acres that burned. And after the fire, what kind of tipped off Heal the Bay that something was going wrong was we noticed a change in our beach report card grades that we were issuing in Malibu. So for folks who don't know, Heal the Bay has this beach report card for 30 plus years now. So we take recreational water quality monitoring at ocean beaches, and we crunch those numbers and run them through a formula and turn them into a grade, which correspond to a letter grade like school with a smiley face. So a good grade means that it's good water quality, low bacteria. A poor grade means lots of bacteria in the water, and it's probably unsafe to swim in. So we've been doing that for about 30 years, and we noticed kind of a troubling trend in Malibu. So this is a table taken from our annual report that we did, not this past year, but the year before it, summer 2019. Don't worry too much about understanding what this table is, I just want to draw your attention to this line here, pre-fire grades. So basically what this is saying is in the years leading up to the fire, about 87% of the beaches in Malibu got an A or a B grade. So that's a very good grade. And only about 13% had poor grades, a C, D, or an F. But after fire, take a look at this last line here. After the fire, we noticed this big drop off in the grades. So a 30 percentage point decrease in the amount of good grades we were issuing to Malibu beaches, and a much higher percentage in the C, Ds, and Fs that we were issuing. So this tipped us off that, there's something wrong here. Led us to kind of hypothesize that, maybe fecal indicator bacteria levels at ocean beaches are impacted by the wildfire. We, judging from this little, report card analysis, it's reasonable to think that the wildfire is causing elevated bacteria in the at the ocean beaches in Malibu. So we came up with this little hypothesis, and to further justify that, where do we get this crazy idea that bacteria levels are impacted by the wildfire? Well, the link between water quality in general and wildfire is well established, but most of that research focuses on things other than bacteria. But the logic should still follow that, you would have higher amounts of bacteria. So due to the lack of vegetation on the landscape after a fire, you would expect that any surface deposits of fecal matter would make their way into the ocean. And, another line of reasoning is with all of these structures that were destroyed in the wildfire, it is possible that some sewage infrastructure was damaged along with that, and that could be another potential, source. That would, of course, need to be investigated more, but that is another possibility here. So that's where we got. That's where our justification for this study comes from. And so what we decided to do was look at the data before the fire and after the fire. These yellow dots now are all the sampling locations in Malibu, and each of these locations has some of their watershed within. So even these on the right side, they're outside of the purple zone, but part of their watershed is within the burn area, so we included them. And this is also another area of future research that, we'll need to add to this, seeing, what percentage of, burned watershed impacts the, bacteria levels. So, but for this preliminary analysis, we didn't focus on that. We just picked beaches that were impacted to some extent and analyzed those. So I'm going to throw a bunch of data at you guys now. So like I mentioned, we compared pre-fire data to post-fire data. And pre-fire data is an average of 10 years. And we averaged the data for all of these sites for the 10 years leading up to the fire. And we did a monthly average. So all the 10 years of Novembers, all the 10 years of Decembers and Januaries are in blue. And we did it that way because seasonality plays a role here. It plays a role in water quality and precipitation. So that's why we did this kind of month-to-month average. We didn't just do a 10-year average of everything. So we averaged 10 years of data for each month, and then we looked at the monthly average post-fire. And I want you to keep in mind that the fire happened in November, and we analyzed data that led from 2018 into 2019. So Back when I did this analysis, I only updated it. I think I only included like 1 year of post-fire data, so it's only through September or October 2019. And I've marked significant differences here with an asterisk, and I did basically a non-parametric t-test, in case you were wondering. So what this is showing you is what total coliform, how total coliform responded post-fire under dry conditions. So what that means is dry means there wasn't rainfall in the last 3 days. There wasn't significant rainfall in the last 3 days when the sample was collected. So you could see here that we have significant elevated post-fire concentrations of total coliform. Things get a little weird as you move away from the fire. In May, we actually see the reverse. We see that the 10-year average was higher. And again, in September and October, you see that as well. So that's an interesting thing to note. When we look at fecal coliform, we don't really see any significant differences here, which is another interesting thing. So total is responding different from fecal. Again, this is under dry conditions. And you notice in September, we get that, later in the year, we see this trend where the 10 years average is actually higher than the post-fire average. And then enterococcus, the trend here kind of follows the same one as total coliform, and even with some of those months where the 10-year average is higher than the post-fire average. So you get that here in January, and you get it again later in the summer, early fall. So that is an interesting result for dry conditions. And just to summarize all of that, total coliform and enterococcus dry weather concentrations were significantly higher immediately after the fire, but that trend is different around 9 months after the fire. So we see that 10-year average actually start to be higher than the post-fire average, which is interesting. And the last takeaway is fecal coliform concentrations during dry weather did not appear to be immediately impacted by the fire. Now let's look at wet conditions. So this is analyzing data that was collected within 3 days of a significant rain event, and you'll notice that there are fewer months down here. And that is because we didn't include months where there was no rainfall. And you can see for total coliform, starting in November, immediately after the fire, there was elevated bacteria. And you see a little later, a few months after the fire, you get this pre-fire average being higher. So that trend kind of continued there for total coliform. For fecal coliform under wet conditions, we did get some significantly elevated levels post-fire, which is interesting and differs from the dry results. And then the same trend holds true for enterococcus, so elevated post-fire concentrations. So to summarize those wet weather results, we see that total coliform, fecal coliform, and enterococcus concentrations were significantly higher immediately after the fire, and as time went on, we found fewer of those significant differences. So to circle back to our hypothesis, what can we really say about it at this point? Well, just preliminary data that I've showed you. This is a data analysis I did a year ago. We've since done more, and we've continued our partnership with other folks. So we've partnered with UCLA, in particular Jenny J and her graduate student Marisol, and we've teamed up with the JPL Remote Sensing Lab, namely Ben Holt and Christine Lee, to continue this project and really get more folks involved and turn this into a bigger thing. So we're really excited about that. And to give you a little preview of what we're going to be doing, so the JPL Remote Sensing Lab is involved because they have a data set of satellite imagery, pre and post fire. And with that satellite imagery, we can take a look at plume characteristics, sediment plume characteristics, and we can see how those match up to the bacteria levels in the water. And we could see, how long rainfall effects linger at these beaches. So we're excited to include that. Another thing we're going to kind of focus on is rainfall, because there seems to be a big impact of rainfall on bacteria. Newsflash there. Don't worry too much about this figure here. All I'm showing you is that there is a significant positive relationship between rainfall and fecal indicator bacteria. That being said, there is a lot of scatter in this data, a lot of variability, so we need to explore this more and really see what the impact of rainfall is before a fire and after the fire. And, we kind of have to control for that effect. And we also need to, so the data, I split it up between wet and dry, using that public health rule, that 3-day rule, which is, it is scientifically grounded to an extent, but, we need to explore that more. Is it 3 days? Is it 5? Is it 10? So that's another future direction that we're headed in. So that I am happy to take any questions. I have my email address there. If folks want to email me a question after the fact, yeah. So anybody? I will take that as a no. We're 2 hours into the meeting, and folks are probably pretty tired. So yeah, like I said, feel free to email me any questions or comments that you have. And yeah, thank you, everybody.